Here are some practical suggestions around treatment. If you're going to suggest AA, call AA in your area and ask about big, happy beginner meetings. To understand what AA is or is not, your loved one should attend for a good length of time. AA is, say, 90 meetings in 90 days. That's 1 meeting a day for 90 days. Family members are sometimes surprised by the daily commitment that AA demands, especially at first. But be prepared to see your loved one out the door every night of the week. AA also has open meetings that you can attend. Suggest going to a meeting together to start, maybe a meal afterwards as a reward. Treatment in this country is uneven and expensive. Make every effort to learn all you can about the places you are going to suggest to your loved one. In a minute, I'll provide you a list of questions for treatment. I often tell families to pace themselves financially. Sometimes a family wants to get the very best for their loved one, and they spend every dime they have on that one treatment event. Spread your resources out a bit and consider the public system or lower cost alternatives if accessible. Remember, treatment success is about 2 things: the willingness on the part of your loved one and the message of recovery provided for by the treatment. What neighborhood the treatment program is located in, whether there are several people to a room, matters less. You're looking for a safe place where your loved one can pause and can hear the message of recovery and learn the skills for staying sober, and a place that provides an assisted plan for stepping down to the next level of care. Everything we have suggested demands that you have treatment ready beforehand. This isn't easy. It means you look on our site, you talk to providers, you get the lay of the land in terms of wait lists, insurance, and so on. You must do the groundwork so that when you raise the idea of treatment, you can be specific and you know the door of treatment is open as widely as possible. Here's the basic information you need to collect on treatment. Who exactly does my loved one ask for when they call? In the majority of cases, the provider is going to need to hear from your loved one. When should my loved one call? What information will they need for the call? What is paid for by insurance, and how will the rest be paid for? What are the wait list times? How's my loved one going to get to treatment? What are the criteria for admission? Some programs demand a certain length of sobriety, maybe 72 hours or a week, or even a month for a halfway house. What evidence does the program have that it works? What aftercare, assisted referrals to other treatment, phone support, does the program offer? Treatment is key. If your loved one has been through treatment before and is still using, it may be that the treatment was wrong or that your loved one was simply not willing enough to listen and try. Levels of willingness and resistance are constantly shifting. Making that connection between willingness to hear the message and getting the messenger in front of your loved one at that exact moment is difficult. Remember, repeated treatment efforts is the case for many. So if your loved one has been to treatment before and is still using, treatment is still the answer. It may be that your loved one remains completely resistant to addressing her drinking or drug use. Is there something else that she may be less resistant to addressing, such as depression or anxiety, or even figuring out a life or career path? The goal is to get them in front of the treater or in the self-help program, and then let the program or professional do their job. So maybe your loved one is willing to talk to a prescriber for help with anxiety. You can always call the professional and give them information about your loved one's substance use. They can't volunteer information, but they can listen. And while not technically treatment, also think about church and the synagogue, temple, or mosque attendance, spiritual retreats, marathon training, and life coaching as valid steps towards recovery. Really anything that competes with the use and provides a pause from use and emotional and physical healing. In short, what will your loved one accept to try right now? Studies suggest that longer periods of treatment work better. This means treatment should be for a good length of time, at least 6 months. When developing your treatment options, Think of every category from the most intensive to the least. This includes medical detoxification and inpatient rehab, partial hospitalization or intensive outpatient programs, outpatient therapy, AA or other self-help, and psychiatry for medication as well as help with common mental health issues. Medical detoxification may be necessary. The rest depends on what your loved one will agree to and what you can help them access. Ideally, these levels of care overlap. We want no pit stops in between, and I mean this literally. If you're moving your loved one from a medical detox to an inpatient program, do everything in your power to make this happen on the same day. If you can't, you will want to stay with your loved one until the bed opens up. This may seem protective, but it's important. Your loved one will be vulnerable after just a couple days in a detoxification unit. This is a time to step in and provide comfort and support to help get them to the next level of care. And finally, if your loved one refuses the help, back off. This is not an opportunity to push your cause. There'll be more opportunities to try again, either because you're reacting more effectively to your loved one or because of the things that happen when you drink and you take drugs. Again, we don't want your loved one to become defensive. Prepare for a no so that you can gracefully back off if you get one. Set up again by looking for the next opportunity to talk treatment, either a wish or a dip or by a planned talk.